Good afternoon to everyone on the line. Welcome to today's webinar presentation. My name is Maria Nalesi, and I will be your host and moderator today. We are very excited to partner with NORC at the University of Chicago to host this presentation, which will provide a first look at new virtual simulation to prepare tomorrow's health professionals. Before we get started, I'd like to go over a few housekeeping items. First, today's session is being recorded, so don't worry about taking notes. We will send you a copy of both the recording and the slides after the presentation. Attendees will also be provided with access to the simulations that will be shared during today's webinar. Next, during the presentation, attendees are in listen-only mode. However, we have allotted time at the end for questions, so we encourage that you submit questions throughout the presentation for our presenters. Next, I'd like to invite you all to participate in a couple of poll questions. If you can turn over to your screen, you will see the first poll questions up there, which is, do you currently provide expert training in your curriculum? Give you a couple of seconds to respond. The options are yes, no, or maybe you are not sure. I'll give you a couple more moments before I share the results with everyone. All right, and the results are split. So 44% said yes, 44% said no, and 12% said not sure. Thank you to all of those that participated. I will go ahead and share the next poll question, which is similar, but in this case, we want to know, do you currently provide telehealth communication skills in your curriculum? And again, I'll give you a couple of seconds to respond. The choices are very similar, yes, no, and not sure. Great, I will go ahead and share. This one was a little bit more skewed. 50% of you said yes, while 27% of you said no, and 23% said not sure. So we hope for those of you that fell in the no category or in the not sure category that today's discussion will help enlighten further your curriculum. And for those of you that said yes, again, hopefully that you will find some valuable insights from today's discussion. So I want to go ahead and now introduce our presenters. I am joined today by Dr. Tracy McPherson, who is a senior research scientist and the expert training, technical assistance, and evaluation lead in the public health department at NORC at the University of Chicago. She is the principal investigator on a 6-year grant funded by the Conrad N. Hilton Foundation to integrate adolescent expert training into social work, nursing, and interprofessional education. Her work is focused on improving access to and evaluating the impact of screening, brief intervention, treatment, and follow-up care for alcohol and other substance use for adolescents and adults. Dr. McPherson holds a PhD in applied social psychology from the George Washington University. Thank you, Tracy, for joining us. I am also joined by Gurnik Singh, who is the head of product for the healthcare market at Kognito. Gurnik specializes in the application of digital innovations to improve healthcare delivery, reduce staff burden, and drive patient education and engagement. Gurnik has held leadership roles as a channel and innovation strategist for health systems and private enterprise, and joined Kognito in 2018 to lead the growth and development of Kognito's virtual human simulation solutions for healthcare. Welcome, Gurnik. I now want to turn it over to Tracy to get us started with today's discussion. Tracy, take it away.
Well, thank you. Thank you so much for that lovely introduction, and it's really my pleasure to be here with all of you today. I'd like to start out by talking a little bit about what we're learning around the emerging landscape of health professional training. You know, what we know is that nursing, social work, and actually many other disciplines, you know, they've been using virtual remote learning in some way for a number of years. But what we're seeing is that many health professional trainings and healthcare organizations included, they're shifting entirely to virtual learning, or they're utilizing it much more as part of a hybrid model of learning, still maybe even a combination of in-person, virtual, and clinical practice and practice settings. I think there's a place for simulation in all training and education. Not that it's a one size fits all, but you know what we have seen is that some have really seamlessly integrated simulation into training and education, and others are really still figuring it out. Virtual learning, including the simulation technology specifically, I think all of it is here to stay more now than ever. And I still believe that although we've been working in this area for many years, and we still see that there is a growing need to train health professionals to deliver service both in person and now even more in telehealth around addressing behavioral health. So recently, we've learned a lot about how simulation technology is really being used to fill those clinical practice hour requirements, and not exclusively, but at least in part, simulation is a nice fit for doing that. What we hear from educators and health professionals is that they're thinking very carefully about the kind of experience that one has in a simulation. Every simulation is different, every experience is different, but really evaluating what is the experience that the learner is gaining from that particular technology. And what we hear is some consensus that they agree that it is an excellent supplement to a variety of training methods, and it's an effective method of training. And as we hear often, it's added value. So, but also one of the things that we all know is that providing behavioral health care for patients and clients is complex. It can be very complex. And although simulation technology, can't replace that direct, in-person and telehealth patient care experience, it offers a very valuable experience in a very safe environment. And not only are folks able to learn, but they're able to receive that coaching and that feedback along the way to really effectively engage those patients and clients in conversations on a range of behavioral health issues, including screening and, for substance use and conducting brief intervention, referral to treatment, follow-up, linkage to care, and using those key motivational interviewing skills that are important in facilitating those conversations. So SBIRT, screening, brief intervention, and referral to treatment, commonly and fondly referred to as SBIRT or SBI, it's an evidence-based practice and that we can use to help, reduce, prevent risky substance use, and to identify those related risks that in those complex cases I was talking about, risk for depression, anxiety, suicide. And what we know is that when young people experiment with alcohol and other drugs, things, they can heat up pretty quickly, and they can lead to substance misuse. And so talking with them, about their substance use and the impacts that it has really can prevent them from having a number of, negative outcomes and serious impacts on their life and on the adolescent's brain development. Through the use of simulation technology, we feel that health professionals can be trained to create that open environment, that open line of dialogue, and really engage using their motivational interviewing skills and practicing those through simulation to engage young people in conversations to prevent the early use as well as to keep it from really boiling over and leading to more serious problems. So what we've seen is a lot of focus on training nurses and social workers and physicians and medical residency programs. Historically, we've seen much of that, but still my observation is that many nurses, social workers, doctors, counselors, psychologists, allied health professionals, they don't have the training in SBI or motivational interviewing strategies They may have had some experience, and maybe they call those things different things in different disciplines, but there's still a lot of opportunity to train these various types of professionals in being able to effectively utilize SBI and MI. So, in addition to these, what I think are more obvious segments of the workforce, there are a number of other groups that I think we need to train. I think we don't often think about these groups as much, but some of the ones, and this is just a light touch of among the many we could be training, are the caseworkers, the community health workers, the peer advocates. So those are just a few. And, for example, I'd like to share with you that, in some cities, caseworkers and youth ambassadors, they're working and they're on the streets working with youth, and they really serve as that preemptive resource, steering young people away from high-risk behaviors. That's just one example of another opportunity where I think we can prepare the workforce. Another example that we don't hear as much about is in the criminal justice system and working with health professionals who are working, in those juvenile diversion programs. And also in tribal, urban, and rural communities specifically, community health workers, they play a very vital role in reaching vulnerable youth and at-risk youth and underserved populations. So, and last, certainly not least, is an area where you're seeing a lot more focus, but we have still a lot of work to do, is in school-based settings. So, for example, not only in K through 12, but recovery schools, recovery programs in colleges, guidance counseling offices, school clinics, and of course, those school-based health centers. And that's just to name a few. So, across all these different health professional groups I've talked about, and an array of various settings, wherever youth, adolescents, and young adults, are interacting with health professionals and paraprofessionals, there really is a great need for training, and we need to be focusing simultaneously on the current workforce, but also the pre-service professionals, the budding workforce. We want them to be maybe more prepared than their predecessors coming into these various roles, and to be able to implement SBI using motivational interviewing skills, sort of getting ahead of and placing it in the curriculums of a variety of programs so that they're well prepared. And we need to prepare them not only to address substance use, but behavioral health more broadly, and those complex cases I was talking about, comorbid substance use and mental health concerns. But ultimately, adolescents and young adults, we know, are a high priority, and we should be paying a lot more attention to them. But ultimately, our workforce really needs to be prepared to work with people of all ages across the entire lifespan, from the adolescents, the young adults, and the older adults. And, I believe simulation technology really offers a way to very efficiently and cost effectively scale up that training across the U.S., both in healthcare settings, in academic settings, in criminal justice, schools. There's an unlimited number of places where we could be scaling up. So those are some of the things that we're learning about the emerging landscape, and I'm sure that some of these things are resonating with those that are joining us today. Next, I'd like to share with you a little bit about the NORC Kognito partnership. I've enjoyed a long working relationship and working with Kognito in a number of ways for a number of years. And most recently, in 2016, we partnered very specifically to address the issue of adolescent behavioral health and screening and brief intervention, and developing conversational skills to help prepare the workforce. And our first collaboration was really on the development of simulation that was focusing on conversational skills specifically around substance use, alcohol use, marijuana use, the most common substances used by young people. But most recently, we're very excited because we've been able to expand that work and collaborate on a simulation that really brings together that experience of navigating a complex case where there is comorbid substance use and mental health concerns. And so I'm really excited today that we're going to be able to see it and share it, and we hope that you will be as excited as we are. So there is much more to come. This is just the tip of what our partnership and our collaborations are about. And many of you will see ongoing partnership activities, and we're very excited about it. And I hope that you all will certainly take advantage of our work together and see how it can benefit you. So next, let me share with you a little bit about some of the things that are available to you right now that complement the simulations. So in collaboration, we have developed a adolescent expert training curriculum and toolkit. Now, this is a very robust, the most comprehensive adolescent training curriculum and toolkit I've seen in the field to date. And it includes the Learner's Guide to Adolescent Expert for trainers and educators. And this is a comprehensive manualized training resource. It has not only the manual, but it has a full companion PowerPoint training slide deck that you can adapt and think of it as a menu of options to pull from to design your own training. And the guide examines all components of screening, brief intervention, referral to treatment, as well as motivational interviewing skills. And it has all of those screening tools, scripted interactions between different types of practitioners or individuals who are interacting with an adolescent or young adult. And it really fleshes out what those conversations feel like for screening, brief intervention, motivational interviewing for every piece of the curriculum. And it has been expanded recently and is continuing to be expanded to address a range of substances, alcohol, marijuana use, vaping, opioid use, so a variety of substances, and mental health concerns, risk for depression, anxiety, suicide. So the simulation training that you're going to hear a lot more about in a moment, it is the curriculum is not designed to duplicate the simulation. It's designed to complement and to create an even more robust package of learning. And in addition to those resources, what's available is a dedicated library of resources, a dedicated website, and it has on-demand webinars that complement, again, do not duplicate, they complement what is in these other materials. And you have a whole host of those downloadable materials like the screening tools and the pocket cards you use in practice and in training and fact sheets and brief intervention protocols. So I encourage everyone to visit the expert.webs.com website. You can click on curriculum, or you can go straight to that website by adding /curriculum, and you're going to see all the resources available to you. So these materials can be used to train others, and they can also be used for self-paced learning if you're trying to just build your own toolkit. So next, I'd like to just point you to how you can gain access. So access to the Learner's Guide and the Adolescent Expert curriculum resources, they are available in one place. It's like one-stop shopping. So you go to expert.webs.com/curriculum. You can request a free electronic copy. You can also order hard copies. And we make those available for the cost of printing and shipping. That's it. And so those are available to you. And access to on-demand webinars I was talking about, again, navigate to expert.webs.com, click on webinars, or just add /webinars, and you're going to get an incredible list of on-demand learning available. And last but not least, if you have questions about SBIRT, you want to learn more about what NORC's SBIRT team does, you're interested in technical assistance or evaluation, organizational consultation services, we have a dedicated email address, sbirtteam@norc.org. So with that, I am going to turn it back over to you, and we're going to get started on seeing our simulation. I'm very excited. So thank you.
Thank
Good
you so much.
afternoon, everyone. Thank you so much, Tracy. Really appreciate you sharing that insight, especially covering sort of the landscape as things shift pretty quickly. Hi, everyone. My name is Gurnik Singh. I am the product lead for Kognito's healthcare simulations, and I build virtual human simulations that prepare health professional students and practicing professionals to lead effective patient encounters in real life. At Kognito, we've spent the better part of the last decade developing, studying, which is key, and delivering evidence-based simulation training. So I'm going to briefly describe virtual human simulations before we actually look at the simulations we've created with NORC to support expert implementation. Next slide, please. So virtual human simulations have proven to be excellent subjects of practice. A growing body of evidence, that really started 20 or so years ago, has shown that people, all kinds of people, race, gender, age agnostic, like interacting with virtual humans. The participants in the research studies have all reported feeling less judged compared to interactions with live persons, and freer to express themselves honestly and experiment in the interaction, which is of significant benefit to learning. Virtual humans offer us as trainers and educators exceptional control in delivering practice that focuses on specific skills with measurable outcomes that can be reproduced with perfect fidelity for every single learner. So Kognito's virtual humans are web-based, and they can be used during live courses, either in person or remotely. There are a number of facilitation tools that accompany the simulations themselves that help facilitators, instructors incorporate the simulations into their curricula and their live coursework. Or they can be used as self-directed supplements for curriculum that allow your learners to practice these encounters on demand at the time and place that's most relevant to them, where they can focus on the interaction in practicing those skills that we want them to learn. So in our simulations, learners meet an AI-powered virtual human that has a unique persona, adaptive memory, and a real human voice, which is critical so that we can support both verbal and nonverbal emotional responsiveness, which is a key component of conversational interaction itself. In addition to the reactions and dialogue of those virtual patients, you can see there are a few additional user interface feedback mechanisms that give each learner critical instruction throughout the training. So I'll briefly describe them here. We'll get a chance to see how these work in practice when we jump into the demo in a couple of slides. But you can see here the coach feedback will help learners understand effective and ineffective choices as they make them. So they're getting dynamic feedback that's based on the decisions they're making in real time. The engagement meter helps learners track how well they are maintaining rapport and engaging that patient holistically. So they're going to be able to achieve their learning objectives only if they maintain a positive level of engagement, right? As engagement drops off, it gets harder and harder for them to actually accomplish the goals for that particular encounter. And we also have patient thoughts that appear periodically to help the learner understand the perspective of the patient as they navigate those sensitive and challenging conversation topics. So it really helps them internalize what their counterparts may be feeling as they go through this conversation, insights that they may not always have access to through other means. Next slide, please. So to build the simulation experiences, we marry the virtual human technology with clinical and communications training expertise. So that's where we work with subject matter experts from organizations like NORC at the University of Chicago to create simulations that develop skills necessary to successfully conduct expert conversations with adolescent patients. But as you can see, we have also applied our instructional design and virtual simulation expertise to a large number of different areas within clinical practice to offer several hours, I think it's up to 50 hours of clinical training scenarios. So learners can gain practice in behavioral health as well as other pediatric conversations and chronic disease cases, while also experiencing virtual patient interactions in an array of settings, which is, whether that's ambulatory care, inpatient, in-home, or our recently added telehealth simulations. So we have also developed practice scenarios to help learners with their essential soft skills for effectively working and collaborating with colleagues. So not just patient communication, but interprofessional, cross-role communication skills as well. Next slide, please. So the telehealth encounters that we've created, really this year, focus exclusively on behavioral health encounters, in large part because of the growing need for developing behavioral health encounter skills in remote environments as a result of the behavior epidemic that's been worsened throughout the pandemic. So in these telehealth encounters, we introduce learners to the best practices for successful remote care visits, and then offer them practice engaging with a virtual patient in a remote setting. So let's now take a closer look at the simulations we've created with NORC, and then we'll get a chance to demo the most recent development. Next slide, please. So in 2016, we launched SBI with Adolescents to add simulation practice to the Adolescent Expert Learning Collaborative, which Tracy was just describing. And as of May of this year, over 150 academic institutions have implemented that Adolescent Expert curriculum. And through this initiative, we have also trained thousands of individuals using the SBI with Adolescents simulation. So that simulation has been used to prepare a variety of roles, again, kind of alluding to what Tracy was mentioning about the importance of training across functions within the care continuum on SBIRT. But specifically a lot of exposure to social workers, nurses, physicians, and a couple of different allied health professions roles as well, to again help them learn how to engage adolescents in substance use conversations. So within the simulation itself, you will review have a brief review of some core topics like the prevalence of substance use, validated screening tools and appropriate interventions, coordinating referrals to specialist treatments, as well as motivational interviewing techniques and how best to use them to speak with adolescents. And after reviewing those core topics in the didactic components, learners actually will meet 3 different adolescents, each with a distinct personality and background that leads to very different conversations about substance use. So learners must follow the steps of a brief negotiated interview using motivational interviewing techniques to build rapport with each adolescent and guide the conversation toward discussions of risk and supporting them in the development of a plan to address their substance use. The first 2 conversations are practice challenges, so they offer guidance on the best approaches and feedback for improvement. They incorporate all of those UI elements that I mentioned previously that provide feedback. And then in the final conversation with Kayla, learners are presented with an assessment challenge that actually will score their simulation performance. And the scoring rubric was developed in collaboration with the subject matter experts at NORC to weight critical components in the sequence of events, as well as the techniques that are necessary to have an effective conversation. So all of those are combined into a weighted average that helps learners understand where they fall in terms of their competency with a quantitative score. Next slide, please. There have now been several published studies evaluating the impact of SBI with adolescents on the knowledge, skills, and behavior of providers. So a few examples that we have listed here. At the University of Michigan School of Nursing, Dr. Strobe has used this simulation for 2 hours of clinical practice in their mental health and illness program across as a required assessment in which students must score over 80 in the assessment challenge before qualifying for standardized patient encounters. So that is, again, one example of the way in which they're incorporated. We have quite a diversity of approaches really to match up with what is most effective for your students and your learning environments. But so in this instance, Dr. Strobe wanted to have students get some level of preparation before engaging in the standardized patient engagements, which obviously can be very difficult to schedule. They are quite expensive as well. So they wanted to make sure they maximize the utility of those experiences for the students by completing the virtual training ahead of time. And Dr. Strobe's team recently published the results of their evaluation on the simulation's impact on students, where they found statistically significant increases in preparedness and competence to ask adolescents about their alcohol and drug use, tailor brief interventions to adolescents' motivation level, help adolescents develop a personal plan for cutting back or stopping use, among several other key measures. And Dr. Kathy Ketting has found similarly positive impacts of the simulation on her advanced practice nursing students at St. Louis University. The results of Dr. Ketting's evaluations have been published as well. And there are 2 or 3 other new publications that are looking specifically at the use of this simulation on their student populations. Next slide, please. So NORC and Kognito are now building on the impact of SBI with adolescents with the launch of a new simulation module that introduces learners to new challenges in adolescent experts. So SBI with adolescents, comorbid substance use and mental health introduces providers to Zoe. And by interacting with Zoe, providers learn to identify and support adolescents at risk of multiple behavioral health issues, including substance use, depression, and suicidal ideation. Next slide, please. So the new simulation specifically builds on the skills that are taught and practiced and assessed in the 3rd conversation in the first SBI with adolescents course. So the interaction with Zoe requires learners to apply motivational interviewing methods to a more challenging adolescent patient encounter and teaches them best practices for triaging adolescents with co-occurring mental health and substance use issues. As learners move through the steps of the brief negotiated interview, their primary goal is to refer Zoe to a specialist such that she is motivated to take action to reduce her substance use and follow through with her specialist appointment. Next slide, please. So through the course of the simulation, learners will practice effective motivational interviewing techniques and gain practical experience in following the brief negotiated interview framework. At the end of their visit with Zoe, each learner receives a personalized feedback dashboard that helps them understand what they did well and where they could have made better choices to engage Zoe and help her connect her substance use to her mental health. Students are evaluated against each of the learning goals and how well they applied the motivational interviewing techniques during the course of their conversation. So let's go ahead and step into the simulation to see how the learning experience works. So we are right now looking at the menu that you will see for the simulation. Learners get an opportunity to get a foundational understanding of the case, as well as approaches to dealing with complex behavioral health cases in the didactic before going into the practice conversation with Zoe. But we'll go ahead and dive right into the practice conversation, and then we'll have a chance to look at the feedback dashboard as well, so we get a sense of how students are informed about their performance overall. So we open up with some background information, again, really level setting for the learner, what they're walking into, what they're going to be expected to do, and some of the important clinical information that is going to be used during the course of conversation with Zoe. Next screen. We walk through the specific steps of the brief negotiated interview, and these steps are going to be incorporated into a map, essentially, sort of a gaming feature that help students and learners understand where they are in the process. So again, we're giving them a framework that they can operate within, so they are able to build on that and really explore their skills in this area and can rely on a couple of key components that they will build upon. Next screen. And then we cover as well some of the motivational interviewing techniques that they're going to be expected to use. So again, really prompting them with what techniques they're going to want to use, the steps that are involved, and then giving them an opportunity to practice them so they can learn when to use certain skills, when not to use certain skills, and what's ultimately going to be an effective approach for engaging adolescents like Zoe. Let's go ahead to the next screen.
Was she able to help you with your cough?
Not really. Said just rest up, hydrate.
I'm sorry we couldn't help more.
Fine.
So we started in the beginning of the engagement. We have come in to talk with Zoe after she has visited with her physician about the cough that she came into the office for. And our objective, again, is to engage her in a conversation about her substance use and her mental health. And we can see right away some of the features that help students learn as they move through the experience. We have our BNI steps that are captured here. We see we're at the very beginning, and we get some directive instruction about what we need to do. So we have to ask Zoe about her life to get to know her, ask permission to raise the subject of substance use, and then ultimately discuss Zoe's substance use before we can move into the next step in the BNI. So the way we'll navigate the conversation is through the talk menu. So if we click on the talk menu, we see a few different tactics will populate. And within each tactic, there are different dialogue options we can choose. So it's up to the student to really decide what's the best way to approach this conversation. Now, I know they told me I should build rapport first, but let's actually not follow the instructions and see what happens. So let's pick discuss use, and we'll ask her about the questions she answered earlier on.
Earlier, you answered some questions about your health and how you're feeling.
Oh, like the 10,000 questions about drugs and whatever?
That's right. We ask everyone to fill those out. Thanks for answering them.
Sure. Am I in trouble or something?
No, not at all. And everything we talk about here is confidential. Unless it sounds like you might hurt yourself or someone else, or someone might be hurting you, or unless you decide to bring someone else in, I won't share what you say here with anyone. I'm just here as someone who cares about your health.
Okay,
Mind if we talk about your answers?
if you want.
So now we see some additional features popping up. The first inner patient thought gives us an opportunity to hear what Zoe's thinking. So let's click on the bubble and see what she says.
I just came for a cough. Didn't expect to get grilled on some random stuff I said on a form.
So her reaction is pretty expected. We're trying to dive into a discussion that she didn't come here to have. So she's hesitant, she's resistant a little bit. And we should expect that things are not going so great because we're really not following the best practices here. So what we can actually do is undo that decision and see if we try to follow the instructions, how Zoe's perception and attitudes might change as we navigate the conversation. So this takes us right back to the previous decision point. If we click on the menu, we see we still have the same options, but if we scroll down to discuss use, we see the one that we've already picked has been highlighted. So we know the path we've already been down. Let's actually try and build rapport this time, and we'll ask her how her day is going so far.
How's your day going so far?
I got out of school for this, so that's a plus.
Not too broken up about missing some classes?
Nope. Well, I have some classes this year that aren't too boring. I'm actually missing my English class, and that's been pretty cool so far.
So we see the engagement meter moves up a little bit. So far, so good. No inner thoughts, no additional components that are giving us feedback, so we can continue in our decision tree. So if we click on the talk menu again, we'll see that the choices have changed somewhat, right? And build rapport has included some additional dialogue options. Let's actually ask her now about what's important in her life and see if we can dig a little bit deeper into Zoe's mindset.
Okay. And what's going on in your life right now? What's important to you?
I don't know. Sophomore year, so the college pressure is starting. And, well,
Go on.
my mom's been having a lot of migraines lately. They just knock her out and she's like throwing up, but she's still got to go to all these appointments and keep working 2 jobs and stuff. So I'm trying to help when I can, but
Sounds stressful.
I'm sure it'll all be fine, but sucks.
So now we have a new thought. Let's see what Zoe's thinking now.
I don't know how my mom does it. I should probably be stepping up for her more.
So there's a level of internalization that's starting to take place because we've engaged her on her terms, started asking her about her life, really building that rapport that has been recommended to us. We're creating some openings where we can start to probe around our key objectives. So now that we've done a little rapport building, which in real life, ultimately that exchange takes less than a minute, we can start to discuss her use a little bit. So let's look at the talk options and now try and ask that question that didn't go so well for the first time and see what's different this time.
Earlier, you answered some questions about your health and how you're feeling.
Oh, like the 10,000 questions about drugs and whatever?
That's right. We ask everyone to fill those out. Thanks for answering them.
Sure. Am I in trouble or something?
No, not at all. And everything we talk about here is confidential. Unless it sounds like you might hurt yourself or someone else, or someone might be hurting you, or unless you decide to bring someone else in, I won't share what you say here with anyone. I'm just here as someone who cares about your health.
Okay.
Mind if we talk about your answers?
Sure, let's do it.
So notice right away her reaction here is completely different, right? We've taken the opportunity to build some rapport, and we've increased her receptivity to the line of questioning that we want to pursue. So her response was different. Let's see if how her thoughts might have changed as well.
Guess those weren't just random forms in the waiting room.
So much less hesitant to start engaging in questions around that. So the conversation obviously does continue. We're still just in the first step of the BNI. We'll get an opportunity to navigate many other decision points, and this branching logic in the conversation can create hundreds of different encounters. So every student could potentially have a different interaction with Zoe. And what we find from our data is that students typically spend up to 50% longer interacting with the conversation than it would take to just play through the simulation straightforward. So we know they're experimenting with the different pathways, trying to understand what works and what doesn't work, and what what would be a effective style for themselves to develop. So just being cognizant of time, I want to share with you the feedback mechanism. So we'll jump back to the menu really quickly. I know we're all excited to see what happens with Zoe here, but I won't spoil the surprise. You'll get a chance to explore this simulation on your own at a later date. But let's take a look at the feedback dashboard just to get a sense of how students are evaluated in the course of the conversations. So we see we have some overall feedback as well as feedback specifically connecting to mental health, and then the BNI steps. Again, those learning objectives that we laid out at the beginning of the simulation. Let's jump back into the dashboard. I think we missed the feedback there. And let's click on the overall. And to click continue. Oh, looks like we are having some technical difficulties, but is available there is a detailed description of how we performed against the objectives that are laid out in the conversation. All the feedback is qualitative. So in this practice conversation, the point isn't to achieve a specific score, but it's really to understand what works well, what doesn't work well, what did I already demonstrate I am capable of, and what are areas that I should be focusing on improvements as well. We can see there are some additional materials and resources here. This includes several different supplemental components, as well as resources to external validated sources that provide more information on the topics at hand. So conducting SBI with adolescents, engaging in difficult and comorbid conversations about substance use and mental health as well. So with that, I want to make sure we have a couple of minutes left for Q&A. So I'll turn it back over to our moderator, Maria.
Thank you so much, Gurnik. Thank you, Tracy, as well, for this wonderful presentation. I know we only have a couple of minutes for questions, so I will dive right in. And again, if you have any questions, please use the question box on the right-hand side of your screen. The first question I will direct to Tracy, but I'll also invite Gurnik to chime in, is what are some of the courses where you've seen these virtual simulations incorporated? Tracy, can you share with us?
Yeah, thank you. Thank you for the question, because one of the things that I learned early on is that there was this sort of assumption that, when you're talking about adolescent substance use, you can only talk about that in a substance use specific course or an addictions course, right? Which there aren't that many of those courses when you think about all those variety of disciplines I was mentioning earlier. They're segments of your curriculum, but there aren't that many dedicated courses in curriculums across the country. So it's what we've learned over the last 6 years is that it's being integrated at the bachelor level, the master's level, the doctoral level. Now, I can give you some examples of some of the courses. They're not in any order or grouped by any discipline, so bear with me. So I'll do this a little bit just off the top of my head. But those foundational field courses and the generalist courses, the health assessment or clinical assessment courses, the HIV-related prevention, stigma, grief and loss courses, rural child welfare, rural primary care, clinical health nursing, and advanced psychiatric nursing with children, human behavior and social environment, chronic health problems, looking at primary care and chronic health problems in primary care and health promotion, social work practice with mental health and addictions, and care of the childbearing and child rearing family. And that's what I have off the top of my head. But there are many, 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 including those substance use courses and substance use intervention courses. So hopefully that helps folks think about where they might integrate, this into their training. And I should not forget, of course, conversational courses that talk about conversation and conversational skills and motivational interviewing. So anyway, perhaps Kernick, you might have some others to share.
No, Tracy, that's a great list, but I think it just represents the diversity of courses where these types of interactions, this virtual simulations, can be effectively utilized. We've seen them in addition to just behavioral health courses, or which includes a slew of topics. You also mentioned communication skills, personal skills, and professionalism skills courses as well. Where again, motivational interviewing as an evidence-based approach can really underpin a lot of those areas.
Thank you so much. And the last question, just because it has come up and I see a few people are still hanging on. Granted, folks were interested in how realistic these scenarios are, but we're looking to see what other scenarios are available. Can you share what other scenarios and topic areas are also available beyond the one you demonstrated today from other simulations?
Yeah, sure. So they cover a wide variety of topics. And as I mentioned, those topic areas, maybe it's possible to bring up that slide that I had shared previously, just showing the different topic areas. But so we cover SBI with adolescents, obviously. We also have SBI with adult populations. We also deal with mental health risk in primary care scenarios, so kind of a wide diversity of behavioral health components. We have a simulation that addresses opioid use disorder and introduces medication-assisted therapy conversations. We have simulations that deal with childhood obesity, and as well as vaccine hesitancy in our pediatrics area. We also have simulations that deal with supplements and steroid use, again with pediatric populations. We have simulations dealing with parenting skills in the in-home setting, as well as geriatric care in the in-home setting. We have simulations that deal with chronic disease conversations. So talking with patients who are diabetic or have hypertension or cardiovascular disease about maintaining adherence with specific medications, lifestyle changes in terms of their weight management, as well as following rehab course protocols. And then we have our simulations that are focused on interprofessional skills specifically. So how do you work and collaborate, manage conflicts with colleagues, et cetera. So that's just a sort of a brief synopsis. There are, a few dozen different topic areas that we cover in the course of our simulations, but these 6 areas really help focus in on those key subjects.
Wonderful. I am going to be respectful of everyone's time and wrap up at this point, but I want to thank our presenters for spending the last 45 minutes with us. All of you who joined and took time out of your busy schedule to listen in, thank you so much. We are going to be following up with the recording and the slides, as well as links where you can experience the simulations Gernick demonstrated for yourself at your own pace. And if there are questions that we weren't able to answer, we will make sure to follow up individually to answer those questions for you. I want to wish you a great rest of your day and week. Thank you for joining us, and we'll see you on the next webinar. Have a great day.
Thank you.